Well, good afternoon to anyone that has joined us today. I hope everyone is staying safe and healthy in these challenging times right now, and I thank everyone for joining us here at Village Physical Therapy and Fitness for today's presentation. This is the second presentation in the series for our Lunch and Learn series. Today's presentation will be about 30 to 45 minutes, and I will open up for questions at the very end of the video. For those of you that are on, if you have any questions, there should be a little text box screen in the side that looks like a text message icon. If you click on that, you can type your questions in there, and I will address them at the end of the presentation. Keep in mind that your questions will be open to the public, so if you have a private question that you just don't want everybody to hear, you're welcome to email me, and my email will be through this presentation a couple different times. I'll answer those to the best of my ability. So today's topic is about something called degenerative disc disease. Today's topic is going to be focusing on why not to panic if you've ever heard this mentioned from your doctor before. So first things first, who am I? My name is Jamie Mazza. I got my doctor in physical therapy from Nazareth College. Graduated back in 2016. In 2017, I was hired here at Village Physical Therapy and Fitness, and I am one of the physical therapists here on staff. I work primarily in the Leroy office at this time. While I was a physical therapist, I did get some what we call continuing education, or a little bit more knowledge on spine care. So through New York State, I'm actually considered a spine care specialist. And actually, there's my email there at the bottom. You'll see this again later in the presentation as well. All right, so before we get into what degenerative disc disease actually is, I just want to go through some back statistics in general. So when it comes to back pain, which LBP stands for low back pain, when it comes to low back pain, typically it affects women more than men. That doesn't mean men can't get it, obviously that's not the case, but it just seems to affect women more. That's what the research has shown. A lot of the research has also shown, and we probably all know this in one way or another, but as we age, we have a higher risk of having some kind of back pain. And I'll get into why that is. When you look at the number of people that go and see their primary care physicians, your doctor's office, 1 out of 17 visits is because of back pain. So that's a pretty high number of people that are going to their doctor's office with complaints of some kind of back pain. It's also one of the leading causes of inactivity, limitation, work restrictions, out of work in much of the world. It's one of those, for lack of a better way of saying it, injuries that really affects a large amount of the population and causes a huge economic burden as well. These are just some general statistics about back pain in general. Before we get into the causes of back pain, specifically degenerative disc disease today, I want to talk a little bit about the anatomy. So in these pictures, the one in particular all the way on the left here, so this is a picture of your spine looking at the side of it. So this on the left side here, that would be the back. On the right side, that would be the front, just to kind of help orient you a little bit. Today, we're going to focus mostly on what we call the lumbar section. That would be the lower part of your spine. So there's 5 vertebrae, those are the bones in your spine. And in the lower aspect, in the lumbar section. I'm focusing on that area today because it's more common. That does not mean that you can't have pain in other places in your spine. You can also get it in your neck, and it's not as often, but you can get it in your mid-back as well. But we're just going to focus on the lower aspect today. When you look at an individual vertebra, so these little bones right here that make up the spine, this middle picture here, from the bird's eye view on the left side and from a side perspective on the right side. The areas I want to address your attention to today are going to be these areas right here. These are called facets. When you do something like bend forward, bend backwards, rotate, any of those kind of movements, your facets are what a lot of the movement is from. We're going to be talking about those areas in particular today when it comes to back pain. This picture that's over here on the right-hand side shows you a little bit more than just the bones. It shows you the discs that fall in between each one of your vertebrae. Those are like your shock absorbers in the body. They allow for a lot of the movement. And we'll be talking about those a little bit today as well. And then in between your facets, right here, are where the nerves come out. Again, important to remember. A little side note too, your facets actually carry about 20 to 25% of the load in your spine, and that's just something to kind of keep in mind as we go forward here today. Before we get too much farther, a couple other things I want to mention. Back pain is one of the most common things. It is incredibly common in the populations. Pain does not equal harm in the body, and we're going to talk a little bit about this as we go on. But the example I like to use with people is if you picture, someone that loses a limb, and I'm sure before you've heard, people that lose a limb complain about pain that's in the limb that no longer exists. Is there harm happening in that limb that's not there anymore? No, but the person still has pain. So that's like a perfect example of pain not equaling damage. For right now, I'm just going to leave it at that. And we're going to talk about that a little bit more later on once we get to what to do about pain. But for right now, just remember, it does not equal damage. A lot of low back pain cases are not specifically identifiable. So in our population, we like to have a diagnosis. You go to your doctor's office and you want to know what is the problem. When it comes to low back pain, sometimes it's just not possible. There could be multiple reasons that cause it, or again, just because you have the pain doesn't mean there has to be damage happening. So you might feel pain in the spine, and that may not be because there's a specific injury. So just because you can't identify with a specific diagnosis does not mean you cannot improve and get better. It does not mean you're stuck with pain forever. So try not to lock onto those diagnoses and identify with them as much. A lot of people that have back pain actually heal completely on their own in a 4 to 6 week time period, which is interesting. So that's just a good thing to kind of keep in the back of your mind. And one of the most important things that the research has found when it comes to back pain is movement is huge, exercise is huge. And again, we'll get into that a little bit more later. So now, what is degenerative disc disease? So I'm sure you've either heard of somebody or yourself have been told by a doctor that you have this thing called degenerative disc disease. Now, or degenerative joint disease. One focuses on the disc, one focuses on the joint. What does that mean? What is this? Well, first of all, when we age, we don't tell you that you have degenerative skin disease when you get wrinkles, right? We don't say that you have degenerative hair disease when you go gray. Yet, we like to use this terminology, degenerative disc disease, when your spine gets a little bit older. This is the gray hair of the spine. It does not mean you're doomed for life. It does not mean you have to have pain. I like to call this arthritis because it sounds a lot better than degenerative and disease in the same sentence. So going forward, I'm going to be referring to this as arthritis, and just keep in mind that this is what I'm talking about. Now, what does this mean? What happens? So as you age, you lose water in your body. That's where wrinkles come from. Your discs, these parts right here, are made up of 90% water. So as you're losing water in your body, what happens is these disc heights just get a little bit shorter, as you can see in this picture. What that means is as the bones get closer together, they start to grow extra bony formations, arthritis. Those bony formations can push on different things and can cause pain. Now, something that research has shown is just because you have arthritis doesn't mean you have to have pain. There's been x-rays with incredible, horrific arthritis and very minimal symptoms, and the complete opposite has happened. So what we found is that just because the arthritis is present does not mean you have to have pain. It can happen along the vertebra here like this. It can also happen on the sides. This is a good picture here of like where you would get some irritation, inflammation, and bony formation in the facets itself. But again, this is the gray hair of the spine. This is a natural process in the body that can happen to anybody. And honestly, I'm hard pressed to find people that have not had some form of this at some point in time. But again, it does not mean you have to have pain. Now, what's interesting is they found that as this process starts, if you remember, I said that the facets have about 20 to 25% of the weight going through them. This changes a little bit in this process. It can actually increase to about 70%, which is why you can get a little discomfort with it. This is also another form of this would be stenosis. So that might be another term that you've heard. You can have two different kinds. So you can have one that affects the middle of the spine. So this is a bird's eye view over here of your vertebra. So this right here would be where your spinal cord would go through. So in this picture, this would be normal. In this picture, this would be a little bit of central stenosis. So you can see the bony formation kind of coming down onto the spinal cord there. This can be a problem depending on how much it pushes on it, or it could not be a problem at all. So it's just, these are the terms that you're going to hear from, you know, imaging findings in your doctor's office. When you have stenosis from a lateral perspective, that's where it affects more the facets. That's the bony growth in the facets. And as you can see in the normal one, lots of space for that nerve to come out. This, again, just to orient you, this is the front, this is the back, these are the vertebra, here's the disc. This is where the nerves come out. This would be normal. And then when you have that bony growth happening right here, you can see where that might pinch down on a nerve. That would typically cause a little bit of discomfort. Now, something to keep in mind, these facets is where all the movement happens in the spine. So again, front and back. So as you do something like bending forward, what you're doing is you're opening up those facets. You're opening up this space, allowing those facets to breathe a little bit more and reducing some of that pain. As you bend backwards, like so, you can clamp down on these areas if you're having some issues, which can cause some pain. So that's something to keep in mind. So that's a little bit about what, you know, this horrific term called degenerative disc disease and stenosis actually is. Again, it's arthritis. Things that cause this, again, like I've said before, normal aging. This is absolutely a normal aging process, and it does not mean you have to have the pain. Plenty of people have it and have no symptoms whatsoever. Poor posture is huge when it comes to the spine. Same with lifting mechanics. You know, the more that you slouch, you know, the more likely you are to have issues. Same with lifting. If you're one of those people that lifts with your back, now is a good time to switch that and start lifting with your legs. These are huge, huge factors when it comes to spine pain in general. Muscle imbalances, what I mean by that. So this is a picture of like your hips essentially in your low back. One common one, and it happens to a lot of us because we're more of a sedentary community at this point in time. You know, we're all on computers, we're all on electronic devices more than we're up and moving around. And what happens in those scenarios are your hip flexors, these guys right here, get kind of short and they get tight. And when that happens, it applies a ton of pressure on your low back. So that would be what this picture right here is showing, is the hip flexors pulling, okay? When that happens, and then your butt muscles are not strong enough, I'm sorry, the hip flexors would pull down this way. When your butt muscles are not strong enough, they can't counteract that at all, so it kind of compounds the problem. So this is an example of a muscle imbalance that could lead to back pain and causing a lot of stress on the low back in particular. There's several different ways that this can happen, but this is just one example. And then obviously trauma and injury, that doesn't help the problem, right? If you're someone that grew up playing some pretty intense contact sports, chances are you've probably beat yourself up pretty good and might have increased some inflammation in your spine. Doesn't mean you have to have it, but it certainly doesn't help. Okay, so what if you have pain? What do you do? One of the best things that you could do is correct your posture. That's actually one of the first things I address with most people. So if you're one of those people that kind of slouches when you're sitting, now is a great time to change that. Sitting up nice and tall, having good posture, not letting your head come forward like this, keeping it tucked back, all of those kind of things really help when it comes to any of these diagnoses. Core strength is huge. And what we mean by core is it's not your six-pack. Everybody loves that six-pack, but it's not the six-pack. It's actually your side stomach muscles right here. Those are your most important muscle groups when it comes to low back pain. The way I typically recommend people engage those is there's two different ways. One, when you laugh, you're actually engaging those muscles. So if you just stick your fingers right on that spot, the next time you're laughing, you'll feel them kick right into your stomach or right into your fingers. The other way I like to tell people to kind of help them learn how to engage those muscles is thinking about bracing for impact. You know, if you were to get hit or end up in a car accident, everything kind of tenses down, right? So if you tense those side stomach muscles when you're doing things like changing position and rolling in bed, that's engaging your core. Your core, those muscles wrap into your spine, and when they're nice and tight, they act like a corset and they kind of help the spine. And in this particular scenario, how it helps is it keeps those vertebrae from coming back down on top of each other. So it kind of helps as far as that's concerned. Now, if you try these things, you've tried the core strengthening, you've tried correcting your posture, and it's still just really bugging you, your physical therapist is actually one of the best people you can see. You certainly could see your doctor, but most of them are going to send you to your PT anyway, and I'll get into that a little bit later as well. Now, if you have pain that is so debilitating that you can't move at all, it's affecting your ability to use the bathroom, you have significant numbness and tingling that's shooting down your legs that's causing you to collapse, those are more significant signs and potentially require you to get a little bit further follow-up. Things like having numbness and tingling in your groin, that I would say follow up with your doctor immediately about that kind of stuff. You know, obviously if you lose the ability to use a bathroom or have numbness and tingling in your groin, those are probably the two biggest things. If anything comes with a fever, obviously that's something to follow up with, but 9 out of 10 times, you know, your physical therapist can help with this kind of stuff. And if you're not sure, we'll let you know. So you're always welcome to come and see us. I'll discuss a little bit more about what you can do going forward here too. So treatment options, like I said, posture. Posture is enormous. And it's not just about how you sit at the computer like this picture shows, you know, obviously not great posture, horrific posture. This is the one we're talking about right here. This is good posture. You know, if you're exercising and lifting, even using good posture in those scenarios is incredibly important. Not lifting with your back, lifting with your legs. Every time you bend over to pick something up, your back should be straight like a board. If at any point in time you lift something and you do this, that's bad posture. That's when you'll hurt yourself. But it's not just about those kind of things. Like, think about the people that, you know, work on assembly lines, for example. Maybe you work at the computer all day, every day, or maybe you're part of some of those factories where you're just putting things together. You could end up in this kind of a scenario over here where you're hunched over for most of the day. If that's what you're finding, there's not much you can do about it. A really good way to address that is to do the opposite movement frequently throughout your day. So interrupt that repetitive movement with an opposite movement. So if you're kind of hunched over all day, every once in a while stop and just extend everything. Okay, those are things to kind of think about. I have this picture of the zoo guy in here because, again, that's one of those things we don't really think about. You know, maybe you have a grandchild at home that you go to pick up. This would be a bad way to do it. This would be a better way to do it. So again, even picking up grandchildren, taking care of pets, anything like that, you know, keeping in mind bending with the legs, keeping the back straight. And of course, if you're caring for somebody and doing things like lifting them, that's incredibly important to use some good posture as well. So correct posture, again, is huge as far as treating back pain is concerned. Other things. So, you know, obviously staying active, like I had said, a lot of the research has shown, you know, way back when we used to think that if you had back pain, you needed to rest, you needed to get off of your feet, and you needed to relax. They've actually found that that's one of the worst things you can do for back pain. So they've now found over the past decade or so that exercise is one of the best things that you can do for your back, getting up and getting movement. Now, this is obviously within reason. If you're having a lot of pain, you don't try to push through the pain. You know, you do what your body can do. You listen to your body. But getting up and getting moving as much as possible is huge when it comes to back pain. Now, at those times when you're not moving, those times when you need a break, finding a position of rest is important. Now, in this picture in particular, I just wanted to highlight that, you know, if you're lying down and you're having pain, think about your posture lying down. Maybe it's because there's too much strain on your spine, your pillow's too thick, your bed's too cushy. You know, putting pillows in certain locations can kind of help reduce some of those stresses on the spine too. So finding a position that's comfortable is really important. Ice and heat can sometimes help. When it comes to arthritis in the spine, based on my experience working with patients and just myself, typically heat feels a little bit better for people, but in all reality, if it's been going on for longer than 2 weeks, either one of them works. Neutral core. So what we mean by this, and I kind of hinted at this with the muscle imbalances, is, you know, in this middle picture here, let's say you have those tight hip flexors and those weak butt muscles. This is what it does to the back. You want to try to get out of this position and end up in this position. So a more neutral position versus, you know, some people sometimes end up in the opposite. Instead of going this way, they end up kind of more like this, and that's how they stand. Those are not neutral positions. Your neutral position is going to be more about here. Now, I had hinted at this middle one here, thinking about pain earlier. Science is still learning a ton about the brain, but what we have learned, again, I would say in the past decade or so, is something called neuroplasticity. What I mean by that is your brain changes very quickly for the better or for the worst. So if you have pain, doesn't matter what your pain is, but today we're talking about back pain. If you have pain and you really constantly think about that pain, you can actually make the pain feel worse. That's what they have found. This happens a variety of different ways. You can also make the pain better by not thinking about it, to say the opposite. What they have found is a couple different things. One, you have different kinds of nerves in your body. Not every single nerve sends a pain signal to your brain. There's nerves that pick up pain. There's nerves that pick up temperature. There's nerves that pick up pressure. There's nerves that pick up the sense of touch. They all do something a little bit different. They all have a different job. They're not supposed to change jobs. Sometimes what'll happen is, you know, your pain nerves will send a pain signal to your brain for whatever reason. And remember, it's an electric signal. That doesn't mean that it's always right. I'm sure we all know that there's been times that, you know, some kind of electronic device has sent you a signal it shouldn't, right? Same thing can happen in your body. Sometimes the nerves in your body that pick up the sense of touch, for example, will start sending pain signals to your brain. That would be a wrong signal. This is what they have found in the research. So that's one way that your pain can increase just by thinking about it and being super aware of it. Another way we've learned that it can change is, let's say, for example, this part of your brain right here picks up pain for some reason. Well, maybe now the other areas start picking up pain and your brain physically changes, and maybe there's nothing happening, but the different parts of your brain are now starting to interpret things as painful. So that's what I mean by thinking about pain. You know, the more that you associate it with it, the more that you identify with it, the more that you focus on it, the more it's going to hurt. Now, the complete opposite can happen. You know, I'm sure we've all had those moments where we've done something and it's been really painful, but it's been really important for us to do something else. You know, maybe you're just really busy that day. You don't have the time to have pain. You don't have the time to be injured. So you do something else and that pain just suddenly goes away until you stop and think about it again. So that's a perfect example of not thinking about it, allowing the pain to reduce. Again, pain does not equal damage, and this is a perfect example of that. So I can't stress that enough. Now, something to think about too when it comes to the core positioning here that I didn't mention before and I want to mention now. When it comes to arthritis in the back, okay, again, like I said earlier, when you bend forward, those facets open up. When you bend backwards, they close down. If you've been diagnosed with, you know, any kind of arthritis in your low back, one thing to look out for as far as positions is concerned is any kind of hyperextension of the spine. And what I mean by that is anything like this. So if you're going to be painting a ceiling anytime soon, be careful. By extending your back like that, you close down on that spine, and that can pinch on the nerves if you're having some issues, cause extra inflammation. Those are just things to kind of be aware of, and it doesn't mean you can't do those things. It just means listen to your body. If it hurts, don't push through it. So other things that you can do to kind of address your symptoms. Believe it or not, eating healthy is huge. They have found that things like alcohol and sugar, and when I say sugar, I don't just mean sweets and candy. I mean, you know, your white bread products, you know, your white rice. that kind of stuff turns into sugar, and it actually causes extra inflammation in the body. So if you're having an arthritis flare, what does that mean? That doesn't mean that you suddenly have more bone growth happening. That means you have extra inflammation in the body, and it's causing the arthritis to bother you on that particular day. So if you eat things that don't cause inflammation, then you can address that and make that better. So it's not just about eating the right nutrients so that your body can thrive and be healthy, eating things that allow you to heal better. It's also about not eating those things that cause the extra inflammation. So that's something to think about. Sleep is huge for healing in general. If you don't get enough sleep, your body has a really hard time repairing itself. A lot of healing happens during sleep. So, and that's a little bit of a catch-22 sometimes, because if you have a lot of pain, sometimes it's hard to sleep. So a lot of it's about breaking into the mental cycle and just getting yourself to relax, getting yourself to calm down, trying to change your thought processes. All of this kind of links together. So sleep is very important. Again, like I said, exercise is huge when it comes to back pain. They have actually found in research that exercise in general actually reduces pain levels. Doesn't matter where your pain is, it reduces the pain levels. It has to do with blood flow. So the more movement you can do, again, in the abilities that you are able to do, the better you're going to be feeling. What they have also found, and at least we have found as PTs as well, is that getting in the pool when you have arthritis is incredibly helpful. When you're in the water, you're more buoyant, so everything kind of decompresses a little bit and opens up those spaces where the nerves are as well. So pool exercise can be very beneficial when it comes to arthritis in the spine. Again, exercise. I'm going to beat this like a dead horse. So when we say core strength, those side stomach muscles, the ones we're talking about are this transverse abdominis, not your six pack, and with it the multifidus. Now, you can't actually activate your multifidus on its own. But when you engage the core, your transverse abdominis, this engages with it. That's what the research has found. Things that engage this, I'm actually going to do another presentation later on, I think in another month or so, that's going to talk about core strength. And I'm going to get into this in depth as far as different exercises that you can do. But for right now, like I said, tightening those side stomach muscles is important when you do things like change positions, get out of bed in the morning, movement. Other exercises that are helpful, it doesn't matter how old you are, strength training is always helpful. Again, making sure it's within your capabilities. Listen to your body. Don't dive into the heavy weights, work yourself into it, and if you have any questions, speaking with professionals is always good. Yoga and Tai Chi are really, really, really helpful when it comes to being able to increase strength, endurance, balance, stability, all of those kinds of things, mental health, flexibility. These are all really important things when it comes to the spine as well. This little picture over here, obesity is a big problem when it comes to the spine. As you can imagine, it places a lot of strain on the back that it's not designed to take. So, doing your best to lose weight, and that comes back into what I said before about eating healthy, sleeping right, eating at the right times, eating the right amounts, all of those kind of things, exercise, all of that is important when it comes to losing weight. But just to keep in mind, the more weight you have, the more strain you're going to have on your low back as well. So really, bottom line, when it comes to, again, my favorite term, degenerative disc disease, also known as arthritis, what you feel is up to you. Because you have it does not mean you have to have pain. You can address it by reducing the load on the spine, by doing things like being active, by increasing your core strength, getting in the pool. The best thing you can do is be active, eating right, sleeping right, all those different things. It's really up to you. Now, if you've tried all those things and you're stuck and you're like, I just can't get through this, I still have the pain, it's not getting any better, you can always reach out to us. These are our contact information for our different facilities. You're always welcome to give us a call, schedule an appointment. you know, even if you're just not sure, if you're like, well, I mean, I think I'm doing the right things, I'm just not sure, you can always reach out to us. I do have our email there as well. That's, you know, in case email works better for you. And of course, our website, you can also request an appointment through our website as well. Now, I had mentioned this kind of earlier, as far as, you know, a doctor could send you to PT, or you can just come straight in and see us. In New York State, we have this thing called direct access. What that means is you don't have to have a script to come see a physical therapist. We can treat you without a script for the first 30 days or 10 visits, whichever comes first. Now, after that 10 visit or 30-day period, at that point, yes, we would need a script. However, if you're having pain, if it's significant and you can't wait, you want to be seen, you can come straight in to see us. You don't have to wait for your doctor's appointment and then to come see us. Now, that being said, there are some insurance companies that do request that script. So if that's the case, such as Medicare is one of those, they might demand that you have a referral before you come in and see us. If you're not sure if your insurance company is one of those companies that requests the referral before PT, you can either call our office and ask, and our excellent front-end staff can let you know, or you can even call your insurance company yourself and find out. That might be good as well. So that's just a little bit of information for you. So again, how can we help? Well, we don't just have PTs in our facility. Well, that's excellent. You know, our physical therapists and physical therapist assistants are more than qualified to help you out with any of your aches and pains. We also have classes that we offer here. So I mentioned a lot about being active, doing exercise. If you're one of those people that you feel that you do better with exercise because you work with other people because it makes you more accountable, we have classes. We have silver sneakers, we have spin, yoga. I mean, any of this kind of stuff. We have aquatic programs. Obviously, right now, everything is kind of shut down with coronavirus. However, we are doing some of this stuff online as well. So if you're interested and you want to know more about that, you can call our office, you can go to our Facebook page or our website, and you should be able to find any of that information there. Working with personal trainers can be huge. You know, they will sit down with you one-on-one and make sure you're doing things correctly, using good posture when you lift, you know, so that you don't have the back pain. Your own exercise programs, either in a gym or at home, any of those kinds of things. You don't have to go somewhere to exercise. You can go for a walk around your area. You can do body weight kind of stuff at home. You know, there's tons of options. And again, like I said, pool therapy is one of those things that's always been really beneficial for people that have arthritis in their spine. It helps decompress everything. So if you have a pool at home, get in it, do some walking, do some exercises, just swim around. Just being in the water alone is going to be helpful. We do have, in the Leroy office here, we do have a therapeutic pool, which means it's just a little bit hotter. So it feels pretty good for most people that are in there. So at this point in time, if you have any questions, I'm going to open it up and check the chats. Again, remember that your questions will be open to the public. So if you have a question that you feel is more private and you want to ask me, just send me an email. So I'm going to look right now and see if anybody has sent any questions. And thank you, by the way, for everyone sitting in on this presentation. I hope it's been informational and enjoyable. So I'm not seeing any questions yet. There's a little chat icon in Teams here. All right, so no questions. So again, I just want to thank everybody who sat in and saw this video. And if you do have any further questions, you're always welcome to email me. And I hope everybody stays safe. Next week's topic is going to be on sarcopenia and aging. So if you want to see that, then you can click on our link. It'll be posted on Facebook as well. But you can click on our link and join that presentation. I hope you all take care. Have a good one.